If I may, just to dive into the bond issuance, we're looking to authorize $50 million of revenue bonds. Last year, we took out a short-term bridge loan of $50 million. The intent was post the end of the year with sustained operational performance to convert that to a long-term debt and issue all the financing for the hospital structure. As you know, January, February, and then March more deliberately wasn't nice to the US of A, and we got hit by an unprecedented pandemic that essentially put a cessation of hospital and clinic operations and really deeply affected healthcare. Altru Health System was no different. That obviously also affected our ability to think long-term in terms of debt allocation, and that's part of the reason that we have sought to convert this at this point in time to a different debt structure, long-term debt, based on our nonprofit status. The initial goal was, as we went through last year, which was a key part of our operational strategy, is to build up our operations, build up our book of business, which we continue to do, and then be able to seek permanent financing. And the pandemic had a significant impact on us both operationally in order to do that and secure the kind of finance that we would want, and actually forced us to cease the hospital operations, which are well known, as I've been in front of the media and I spoke to this at several different venues off and on over the last 9 months. What we did do in terms of deciding what was probably the best strategy was engage our bond counsel, which is Ponder and Company. They've worked with Altru Health System for many years, most recently since 2016. And under their advisement, we had many different opportunities to consider refinancing this. What we felt was the best strategy was the long-term conversion strategy, because it did allow us to take that off and convert that from a short-term debt, which improved our financial status, and convert it to a long-term debt, but also realize the history of this type of debt structure, especially with major projects such as capital building projects in healthcare. It's very common to convert that to a long-term structure. So that is the purpose of what we seek to come to a resolution with you today. If I may, just want to kind of give you a brief update about where we're at. And Michael started off us very classically with what we're dealing with every day, and that's COVID. Every hospital and health system in our region, in our state, in the Midwest, throughout the whole U.S., were deeply impacted. Altru was no different. We faced a very concerning, potentially devastating financial impact that could have affected us long term. However, the history of Altru is not one to not take challenges on and adjust to the climate that we're faced with. As you know, and many of you have been in this community, and I moved in this community in 1999, we made it through a flood. In fact, we didn't have any federal support through that, as I talked with Dave about how we managed as a community. And then Altru suffered a building collapse, and then all the other financial calamities that we've all struggled with. This was another one. It's different than others. It's a biological, ongoing threat. In fact, if we think about where we sit right now, we're not through COVID yet. And, that's a reality. We had an implementation phase. In that implementation phase, we sought partnership with you, the city, the council, our region, institutional partners at UND, the Grand Forks County, Grand Forks School Department, and every other Air Force base. And we developed a strategy to protect our community, and I think we served that indelibly. That didn't come without cost. That vigilance, though, which started back in February, continues through to now, and is a reason where we stand as a community in charge of our destiny in terms of how we're handling this pandemic. If I may make a couple comments, I know that hospital capacity has been an issue and been brought forward multiple times. It's a very complex moving target. There's not a really set way to measure it every day. Your point in time and at noon can be very different by 1 o'clock, because the emergency room where I work in, you could fill the hospital up in an hour real quick. And what I mean by that, you can have 10 or 12 admits when you didn't have any for a few hours. So very dynamic process. Yet, despite all those dynamic issues, the challenges we have with our workforce staff being exposed and the testing strategies we've been a little bit handicapped with, we've been able to maintain operations and take care of all of our patients in our community. In fact, over the last 2 months, for you, Councilman and President Sandy, we've been beyond capacity. And what I mean by capacity is just, that's an ER doc's term of where we are. We're just really full. And what I mean by that is our medical admissions, typically from day to day, year to year, prior to this pandemic, would average about a census between mid 140s to mid 150s. For the last 2+ months, we've been sitting between 160 and 195. Most of the time, except probably really this last weekend, we've been managing COVID quite easily in our community, and we really haven't had a very high census. So our impact of our operations at the hospital has never been challenged in terms of COVID. And in fact, even with 17, we're managing that just fine. The real strategy to that is managing your beds and transferring your patients out back to their communities where, 50% of our patients we take care of in this great city come from the regional areas and stuff. So we're working with our community partners in the region, the critical access CEOs and the directors of nursing to figure a better strategy of how we can offload our critical hospital, which is our tertiary facility in this region, to maintain operations for all our citizens when they're needed. And that's just a little bit of a measure of how we've been navigating through that. So while I wasn't happy seeing that we were at 17 Friday and then 18 Saturday, back down to 17 and now maybe down to 16, those patients are recovering faster than they did prior. They may come in sicker, but they're tending to not end up on a ventilator more often than not. And if they do, this course is very limited. The collaboration that this organization did with Mayo Clinic and Hopkins and other great institutions was practice best practice for COVID, and that practice has changed from day one back in February all the way through now. And I've had colleagues of mine and friends of mine who've been sick, quite sick with this, recover remarkably better than, based on the lessons that have been learned. But this is a work in process. COVID isn't going away, but we're managing it to the top ability. And something that I'm very proud of, and in fact I'd say boastful of, is this health system in your community, my health system, your health system, our community-based health system, which is what Altru is, was the first in our state to give convalescent plasma in April, when it hadn't even been given out 16 times in all of the USA. We were asked by Mayo to be part of a strategy, research development that they were partnered with Hopkins and a Texas affiliate that I can't remember the organization's name, if we wanted to partake in studies of that. And we had a very sick regional patient from a community north of us who insisted, hey, I saw this on the media, can we do this? And their family member was very ill, like life-threateningly ill, and had been on a ventilator. And I think because we were able to get that convalescent plasma and then just to continue with the great care that we did, we were able to turn him around. And that's I think that's an amazing description of what we're committed to achieve here at Altru for the city. Going forward, where we've been at, another thing I'm extremely proud of is our ability to adapt. We faced a really serious impact financially, like all organizations. If you recall the Mayo, they talked about losing $1 billion. Some organizations bigger than that, based on cessation of their procedural-based services, which is the operating engine of the hospital. Health systems generate revenue by hospital operation and performance. They do not by the clinic. It may seem counterintuitive, but that's really the reality of it. We had to cease those operations. There was no choice. Had a very strong conversation with the governor, who said, Steve, I hope you're stopping your hospital and I hope you're stopping your procedures. That was very early on in early March. It wasn't an easy decision, but it was a necessary decision. Faced with that, we knew we had to do a lot of things. One is we had to provide great care, and that led us to our partnership and with the state, with the region, public health, with the city, and we did that. And we pivoted and we adjusted. We also had to do operational impacts, and we did have to affect some workforce, administrative workforce. That's a reality that we had to do based on our organizational size and structure. The goal of that was to maintain our ability to function and operate and provide great care, which we did. We did receive some grant funding, as you're aware, from the federal government. That did help our operations. It was about 5 days cash on hand at each venue that they gave out, and then 1 day, so it was about $26 million. It offset our losses about maybe half. But more importantly, the operational adjustments that we've done now put us in a position where there's a very high likelihood we're going to end with a positive margin at the end of this year, certainly 0 to 1.4, which in fact, when we look back at where our operational performance was pre-COVID and directly affected by COVID, to know where we're sitting from a financial perspective, that's pretty incredible. And that's, again, a testimony of what we're committed to do to provide care and maintain ourselves as the organization for this community. A big question I get asked all the time, of course, and I'm a citizen. You got to remember, I'm a physician, I'm a dad, I have kids. I love this community. I care about healthcare. My North Star for you and all and us and myself is outstanding patient care quality and patient care experience. I feel when you do that, the rest takes care of itself. We are a single entity healthcare system. We have 100 plus histories. My intention is to be the best health system in our state, in our region, and Midwest even. And that's what my driving force is. I think when you have that vision and create that, the rest of things will take care of themselves. Part of that is finishing this hospital. To finish that hospital, we have to simply have our book of business in order. We're still going through COVID. We're in a maintenance phase right now. We're not even into recovery phase. And as you saw per Michael's report, going up to 17 COVID patients in the hospital is no joke. It's very serious still. We don't have a handle on it. And our operations are still affected because despite our turnaround financially, which I'm more than proud of as an organization, we're still down about 18% of patients coming in. That means people are still fearful of coming in and getting their screening and their care. And despite being down that much, patients and customers, it's hard to call them customers, but that's what they are. But they're our patients, they're our community members. We're operationally looking very strong going forward. But for us to resume our hospital, for us to be in the position that you want us to remain in and evolve from, we have to demonstrate a strong operational bottom line moving forward. And we will, and we are. And this year looks great, and our forecast for next year looks even better. And it's a matter of that vigilance. We're guided by one thing and one thing only. We are the health system for this community. We have been for 100 plus years. We will remain that. We will provide what you deserve, I deserve, my family deserves, all of our families deserve is outstanding health care, and we'll deliver that. I understand that everybody wants to have a set time and date, and I'm excited to get to that more than anybody, but I realize my responsibility is driving quality, driving the experience, financially making us sound and strong going forward, and resuming and building that. That to me is the cherry on the top of where we're going to get to, and we will get that and complete that, rest assured, President Sandy and members of the council and mayor. I have colleagues with me here today, which I should have introduced early on, but I'm not usually used. I speak to a lot of people every day, but I haven't been in front of the council before. But my colleague Dave Mullen, who needs no introduction, but he's a legend in himself for this community, and very, I would say that a goal of mine would be to emulate his commitment that he's dedicated to this community at the resolution of my career, whenever that may be. My colleague Craig Faber, who's our CFO, and Tom Tweeden, who's our manager accounting, are also available virtually. So I'll permit any, if you have any questions for me, I'm happy to address as best as I can, and my colleagues would certainly help out as well if needed. So.
Thank you so much, Dr. Weiser, for that discussion. Any comments or questions?
President Sandy?
Yes, Mr. Veen.
Yes. Thank you, Dr. Weiser. I appreciated your report. A couple questions. You said you had 17 cases in Altru right now, but that's well beyond Grand Forks County. I mean, the Altru serves northwest Minnesota, northeast North Dakota. So if you were to approximate, how many counties do you think you're actually serving here in Grand Forks, or what population base?
Well, yeah, so the clarification is great. I mean, I would say, well, we know it's about 230 to 240,000 residents that we provide coverage for from northwest Minnesota through the north of Dakota, and then some of the little bit of the south region. It's quite a big area of expansion, and typically, based on our hospital day-to-day census, a minimum of 50% of patients are regional patients from whatever county. whether it's Grafton, whether it's Roseau, Cavalier, Langdon, you name it. So Altru's history has been such that in our hospital census, about 50% of our daily admissions come from outside our immediate county.
Do many of those hospitals, other hospitals out there, have COVID patients, or are just the more extreme patients brought to Grand Forks then?
Yeah, that's another great question, Councilman Veen. So something that Altru has done for years is really worked with our regional critical facilities, and very early on in the pandemic, just as a testament as our commitment as a tertiary facility for them, we liaised with those CEOs and DONs and made a strategy of what they could feel comfortable taking care of and what we would have to. And a common misperception that, we deal with at the state level, I speak with the governor and his team on this on a regular basis, is our critical access facilities are not designed to handle really complex patients. They can handle patients that have been stabilized and treated and what we'd say turned around a little bit, so their requirements are more basic nursing needs, but they certainly don't have the capacity to handle a very sick COVID patient. Having said that, a lot of them in their nursing facilities have managed those patients for a couple days, and generally speaking, everybody has a fear, especially the elderly. If they get it, they're going to be mortally ill from it, and that's simply not the case. Comorbidities certainly increase your risk, but a lot of these patients do recover. So those facilities in our region do their best, and they'll monitor them for a couple days, but with our liaison with our hospital staff, our critical care staff, we take these patients pretty readily so they don't progress further on, but they do try to keep them there for a day or two and monitor them. And a lot of those patients do end up staying there, even in their nursing facilities. So.
Okay, Mr. Veen, yeah?
Yeah, and one last one. I think, from my experience, one of the major issues has just been staffing, nursing, respiratory therapists, and the like. It's not just beds, and we seem to focus on beds, but not all the other aspects of it. Can you just describe how you are able to, or where we are at, considering the large area we are in, with maintaining the staffing for these critical ill people? At the same time, you have a lot of others that are in there that could be critical ill for other reasons.
Yeah, thank you, Councilman. So I would say that the bulk over the last 2 months, easily, 2.5, have been patients that are not COVID at all related in our ICU. In fact, our ICU has been full. With regards to staffing, I'm actually pretty amazed, despite the fact that if you ask the mayor, I've been barking to the governor about getting localized testing, regional testing here. And I've even mentioned with Councilman Weber on a few partner meetings way back when. But we're in a position we're trying to make that happen. The reason that's so important is that when we're managing the full hospital, we're running censuses 160 to 190, and that's tight. Yet we're still taking care of everybody. When you have a staff member, a respiratory therapist, a nurse, a tech, an aide, anybody who's exposed, whether they develop the illness or not, it's based on testing, so to confirm. So the sooner we can test, the sooner we can maintain our operations and not have any impact on our beds. This week, yesterday and today, was a big uptick in exposures, community-based, non-hospital-based, community-based, of 30 staff, various staff, aides, nurses, techs, etc., who were exposed in the community are waiting their testing. So that's a 48-hour period or longer, but it's been pretty good. The state's done a phenomenal job, don't get me wrong. We've really valued that partnership. But that implicates our ability to manage staffing around the clock and different types of pivoting for different wards. Do we have enough staff to cover that ward, fill all the bed capacity? Despite all that, we've actually mitigated this incredibly well. But we would be better served, and you would be better served as a community in our region, if the city divested, Thermo Fisher to this community, which we've asked, and we're in the process of figuring that out. But that would mean we would do further testing, surveillance testing that Michael reports to, the assisted living facilities that Michael has reported out on as well. But we'd be prepared to do that. We'd have to put the infrastructure in there. But despite those challenges, and that's probably, I would feel, our biggest challenge as an organization on this COVID crisis, and the fact that the business is returning because people put off their care, is the ability to manage our staff, protect our staff, and work and avoid people being sidelined because of an exposure. And I will highlight too that nobody in the hospital, working in the hospital with our mandated PPE structure, has ever contacted COVID from a COVID patient. Zero. something we're incredibly proud of. So we fostered that. I will say though, for all of you who have family members and in healthcare here, to give them a little bit of a pick-me-up, pep talk, and because it's been a real hard grind. This workforce of 3,500 people are hurting, they're tired, exhausted, and there's no end in sight. So we're trying our best to figure out how to raise that up, because we have to keep plugging away, because we have such a huge responsibility that we fulfill every day to this community. So.
Thank
Great
you.
question.
Yes, Mr. Weber.
Thank you, President Sandy. We are so fortunate to have a locally owned, locally controlled hospital in our community. The easiest way for people to think of that is at some time in the last year or two, probably most of us, either for ourselves or a friend or family member, have visited Altru. Imagine if we had had to drive to another city for that care. We're lucky to have you here. Thank you. Everyone wants to protect their health, and many are fearful about going to their healthcare providers right now, including being fearful about going to the hospital. And instead, it may be one of the safest places to go to right now. As you've just mentioned, there have been no staff. Could you speak to that for a moment?
Yes.
There have been no staff who have had a positive test.
Nor do we know of any guests who've come to the hospital to visit their family members develop COVID after being in our facility. So that's true. I mean, something very hard we implemented was a two-pronged approach. One is protecting the facility, protecting healthcare workers, and I'll remind everybody, the members of the council, President Sandy and the mayor, that we had those lights for Altru. We had all this community robust engagement supporting our staff, knowing that it was important, and everybody demonstrated great citizenship. And they continue to. I think they're just stressed about it. It's just been a long haul. And that's the challenge we face, is sustaining this from a community to control the spread and maintaining that vigilance that a mask do help, social distancing does help, and trying to stick by that. So, but we have not, we had tight restrictions early on, and then we initiated a safe start strategy, because we knew we could start, very early on for the first several months of this pandemic, as you might recall, and we didn't talk about our census very much, but anytime I was on a venue, I explained, we went 2 months without a COVID patient in the hospital. And then it started creeping up, and it stayed and hovered pretty low, 5, 7. That's what I've been telling my institutional partners, colleagues. And then just over in the last week, and I'm not sure why it took a bit of a spike, I expect that to come back down. The county numbers are starting to come back down.
Good.
But a lot of this is behavior, sports, families, grandparents going out to watch football, the football teams, soccer's not on right now, but I guess volleyball, other sports. So that seems to be a bit of a nidus. But when we did our Safe Start, what we did was we partnered with Mayo and got 500 plus tests a week on a separate note, separate from the state, so we could test any patient who needed a procedure. Because we felt it was very important that surveillance screening, cancer screening, all those important things that people need to get done for their lives could get done, but they have to be started in a safe process. So in collaboration with Mayo as well as the state, we figured out a cadence to pre-test everybody coming in. So we were not putting ourselves at risk or our staff at risk, because you can imagine if your facility shuts down and you can't do emergency surgeries because you don't have enough surgical techs, surgical nurses, PACU staff, et cetera. It's so important, and that's another measure of caution that we instituted very early, and we carry that on to this day. We have that perfected, well, not perfected, but again, it's a pretty efficient process that we have that's allowed us to build our operations back up again and helped our financial performance, no doubt. But I still, I'll just harp on it. I really want the state to cut us loose regional testing, because I think Altru has demonstrated its ability to be a regional site to protect 230,000 citizens very effectively and do a conveyed message with institutional partners led by the city council and the mayor of how important it is. And if you look at our city and how we've managed this compared to the other cities, there's a tremendous amount of pride. I feel that every day.
Fantastic.
And we just have to keep moving it. So keep on point. So.
Very good. We have some numbers that are a little worrisome. You're optimistic that we're going to see some of those come down. But in the meantime, if you've been putting off that test, that checkup, that screening, This is a good time to come to Altru and get that work done, yes?
Yeah, we've been open for business in a safe fashion since May 25th was our opening Safe Start strategy were implemented. So we were safe prior to that too. I mean, we just restricted visitor access, whether it's coming to the ER, but if you had a stroke, a heart attack, whatever ailment you had or a trauma, you were taken care of in a protective fashion throughout. And as you recall, because it feels like eons ago, we had a sick clinic established where patients with symptoms would get screening to avoid them from going to the standard clinics, and we directed that in the COVID hotline, which is over 40,000 calls. It's just, it's been a great strategy that we've done in our collaboration with you in terms of how we protect this community from a real high-level public health perspective.
Congratulations on all that, and thank you for all that work. This plan of having the city help with the bonding, this is not new. This is something that we've been contemplating since the beginning of the construction project. What else is Altru doing to assure the success of this important construction project? Is it just the city's support, or what else has been done? You've mentioned some cuts and other changes. Anything financial that we should know about?
I mean, I think it's, we all are aware of what happened with our bond rating, as an example. As we show our fiduciary responsibility and show our operational performance, that's what our position is. I mean, we have to maintain a positive bottom line, which despite a pandemic, we look like we're going to show that. We have a forecast for a 3 to 4% margin next year with an EBITDA 10 to 12%. And we believe with all of our operational improvements, which we've established, and I wouldn't call the reduction in force and operational improvement. It was something we had to do from a workforce-related issue, but all the other strategies in terms of efficiencies and how the hospital is run, contract management, there's about a list of 20 different areas that we work on. That gives us our strength, and the proof will be in how we sustain that going forward, and that is how we will gain our strong foothold and be able to go and get the rest of our financing.
Thanks for that clarification.
So, yeah.
Good. Just a couple last questions. Can you give us some sense of what this would save Altru, this collaboration with the city? And I want to make sure both what's the savings for Altru, what is the cost for the city or the risk for the city? So that's maybe a question from Ms. Storstad, but if you could give us an idea of the benefit for Altru, first of all, of this arrangement.
Yeah, so I'll if Craig is on or Dave, I'll let them handle the fine time numbers. I'm an ER doc, so I do know numbers, but not as good as them.
This is Craig Fairber. I am the interim CFO. And as far as saving us money, what this really does is allows us to take the short-term loan, which is actually due at the end of November, and turning it into long-term, a 15-year borrowing. And so what it does is just extends our cash flow for this $50 million. And I know the attorney's on for the deal, and as they mentioned earlier, it doesn't create any risk for the city, and it doesn't cost the city anything. But this would be very helpful with our long-term financing to extend this from a few months now to 15 years.
Very good. Thank you. Thank you, President Sandy.
Thank you. Any other comments or questions for Dr. Weiser?
Move approval.
Mr. Weigel moves approval. Is there a second?
Second.
Second by Mr. Veen. Mr. Feeling.
I just wanted to say a few comments about all that Altru's doing, and I think this impacts their bottom line, but they still did it. Some traditional things that would be probably done by a community in their public health area, and we had meetings with Altru on this, is, they've operated a COVID hotline, which is a function that they've done on behalf of the community that is done at a reimbursable expense. They've done a lot of curbside testing for folks that, again, a lot of that is not reimbursed. So when you talk about having a community-owned hospital, they've stepped forward, and if we didn't have Altru just stepping up to do those things, we would be presumably using some of our CARES funding and some other funding to do that, but Altru stepped up and just did it. And I think the other thing with the institutional partners, sometimes you meet with institutional partners, and maybe you don't get the A-team, but every time we meet with Altru, it's Dr. Weiser, it's Mr. Molman, and whomever is on their top tier on the decision-making every week, so we really are impressed by that. And I think the other thing, I think we should all be impressed by the financial turnaround. The fact that they're going out to the market currently, right now, is a really good sign that they're doing well. And I would suspect, Dr. Weiser, you're just an ER doctor, but there must be a lot of demand for these bonds because they're going out to the market. So just on behalf of the community, I think those are all great signs. And they've even absorbed some expenses that are not being reimbursed because of this, and really helping to support the city in filling niches that we didn't serve, or we would have had to step up. President Sandy.
I think it's easy to take your health system for granted. You assume they're always going to be there, and when you're not feeling well, you can just call the hospital or make an appointment or show up in the ER. I think the most important thing that Dr. Weiser said to me today is to thank all the men and women that work in our hospital system, because you're right, the stress that people have been going through these days is unprecedented. And I know, for one, I take our hospital for granted. I'm sorry I do that. I really appreciate that Altru is always there for us, and I appreciate all the people, the good people that live in our community that work there. So thank you very much. There's a motion and a second on the floor. Any other comments? Yes, Ms. Ma?
Do we have ongoing communication between like the mayor's office and Altru to know if he would ever get into staffing issues or have capacity concerns, so that we know in real time if we have an issue?
I'll say we do.
Yep, we definitely do. We have scheduled weekly meetings, but there's also as-needed types of meetings, and so I can recall, I would say in a recent history, where there were some concerns leading up to the weekend and what was going to be happening, and we get calls from Altru just so that we're not the last to know, we're the first to know, and so that we can share it with important leaders in our community too. So that's an ongoing thing, and it's remarkable that we have this relationship, and it's a mobile phone call away.
The other question I have is, do you have that type of relationship with other hospitals in the state? So do we take patients from Bismarck knowing their numbers are so much higher, and would they take our patients if we had that issue?
So healthcare is really complicated, and that's a fantastic question, Councilman. We've, for years, leave COVID off the table. Our hospital is an ER doc. Sometimes we're full capacity in our critical care patients or med-surg patients or trauma types of patients. So we often transfer inter-hospital area within our state. We share that resource, whether it's with Minot, whether it's cross-state to Bismarck or Fargo. More commonly, it's Fargo. So we've, surprisingly, you'd think a big facility like they have couldn't fill up, but they do, and they've sent patients to us. It's been a cross-collaboration. That's just really what healthcare is. And, you know, more importantly, recently in discussions I've had at the state level and working with Tim Blazel as well as the NDHA and Chris Jones is, you know, we need to understand our full bed capacity of the state. It's a utilization problem, not a capacity problem, which means that we have to have the A game across the PPS facilities, which are what I would refer to as our tertiary facilities. But our critical access facilities need to be always ready to take patients and maintain that staffing, because that's how you allow, when you're at capacity, to offload certain types of patients that are healing. You know, a pneumonia patient, you don't need to be in the hospital for 2 more days. They can go to that facility as a classic example. But we do cross-share and collaborate, absolutely. So.
Great. Any other comments? Questions? Hearing none, all those in favor signify by saying aye. Aye. Opposed, same sign. Motion carries unanimously. Thank you so much.
Thank you so much for the opportunity.
For coming. Thank you.